Efficiency. It can be done in all parts of your office. What I've laid out here is how we do our room setups. Just taking this simple, repeatable set of steps and looking at how you can do more than one thing at a time. You can take the amount of time that would normally take for a procedure and shorten it. We've had assistants that come into our office who were used to doing things at their old office in a way that they would do each step one right after the other without trying to combine them and make them overlap, and it was taking them way too long to set up a room. So we decided to go through and look at our systems and see how we could make it better. And we found areas that we could overlap or do more than one thing at a time, and that's made our setup time just a few minutes shorter, which if you're talking about seeing several patients a day, those extra minutes can really add up to keeping you on schedule and keeping your patients from having to wait out in the waiting room any longer than necessary. We'll just go over just a couple of examples. For example, when the blood pressure and pulse monitor is doing its thing, that'd be a great time for the assistant to just confirm the treatment plan. If someone's coming in to do an MO filling, let's say a number 31, let's go ahead and confirm that we're doing a filling on your lower right molar today. And the patient will usually say, yeah, that's right, that's what I was expecting. Or if that's not what they're expecting, well, it's great that we check it then before we start moving on to placing anesthetic. So we always confirm treatment plans, but again, that can be done at the same time that the blood pressure and pulse monitor is working. We can just be setting up the room as all these different steps are proceeding. Some assistants like to get the room set up ahead of time, which is nice. Of course, it's the first patient of the day. It should be set up ahead of time, but as the day progresses, the room can be set up while we're waiting for all these different things to occur, like waiting for anesthetic to take effect, waiting for the doctor to come in to actually give the anesthetic. So the room doesn't have to be completely set up before the procedure actually begins. And just knowing that one concept alone can help shave several minutes off of your setup appointment time. So anyways, if you just look through this list and look at what you do at your office, I think you'll be able to see some efficiencies that can be gained from doing something similar to this. So I hope this has been helpful, and thank you very much.